Good morning, Friday, May 15th. I'm Alex with Main Street Briefing. Today, small group health premiums up double digits, restaurant traffic still soft, and the retail number that pushes the other direction. 3 stories, 5 minutes, done. First, small business health insurance for plan year 2026 is hitting books with the steepest hike in years. Across 318 small group insurers in all 50 states and D.C., the median proposed premium increase is 11%. About 1 in 10 policies are coming in 20% or higher. For an owner who provides coverage for 10 employees on a family-skewed plan, that translates into roughly $25,000 to $30,000 in added annual cost before any change to the plan structure. The KFF analysis points to 3 drivers. First, the underlying medical trend, what hospitals, doctors, and labs charge, is running about 9% higher year over year, which is on the high end of recent decade history. Second, prescription drug costs, with insurers specifically calling out GLP-1 weight management drugs as a major cost line. Some insurers are excluding GLP-1 coverage for weight loss specifically for 2026 to hold premiums down. Third, normal economic inflation in carrier operating costs. Federal data shows only 1 in 3 small businesses currently offers any health coverage. For owners on the bubble, an 11% hike could be the year coverage gets dropped or restructured into a stipend model. What to watch? Ask your broker by next week for a written quote both with and without GLP-1 weight loss coverage included and a side-by-side total cost comparison. Story 2, restaurant operators are still working against soft traffic, and consumers are signaling why. The National Restaurant Association's 2026 State of the Industry report found 40% of consumers are already cutting their restaurant frequency. More than 60% of operators said they saw traffic declines in 2025, and the early read on the first quarter of 2026 suggests the trend continued. McKinsey's separate consumer research framed the same shift differently. Diners are not abandoning the category, they're rethinking the value of every visit. Persistent inflation, tariff pass-through on food costs, and economic uncertainty are pushing consumers to swap a sit-down dinner for fast casual or a fast casual lunch for a packed one. The cost side is also getting harder. Food costs are projected up across 2026, with beef called out specifically because of supply tightness layered onto tariff effects on imports. 61% of restaurants are still tracking to deliver positive same-store sales for 2026, but that means 39% are not. Operators winning right now share 3 patterns: sharper menu pricing tiers, faster digital ordering, and smaller staff models without sacrificing speed of service. What to watch? Pull your last 6 weeks of cover counts by daypart and compare against the same 6 weeks last year. Flag any daypart down more than 10% for an immediate menu and pricing review. Story 3, retail just delivered the brightest small business data point of the month, and the headline misses it. Advance estimates from the Census Bureau show U.S. retail and food services sales for March 2026 landed at $752.1 billion, up 1.7% from February and up 4% year over year. That's a real number. After 3 months of mixed reads weighed down by tariff uncertainty and weather, March was a clean acceleration. The category mix tells the story for Main Street. About 74% of companies in the same-store sales index are tracking to deliver positive comps for 2026. That's a meaningfully higher share than the restaurant sector, suggesting goods spending is holding up better than dining out spending. 2 caveats. First, the year-over-year 4% number is barely beating the underlying inflation rate, so real volume growth is closer to 1 to 2%. Second, the gain was uneven. Non-store retailers, building materials, and health and personal care led, while clothing and furniture were softer. For an independent retailer, that means category positioning matters more than the macro headline. The April retail sales report drops Thursday next week and will tell whether the March acceleration held or was a 1-month bounce. What to watch? Pull your March same-store sales versus last March before Sunday and decide whether you're pacing the 4% year-over-year benchmark. If not, identify the category dragging. That's Friday. Health premiums climbed double digits, restaurant traffic stayed soft, and retail showed signs of life. I'm Alex. Have a strong weekend. 3 stories, 5 minutes, done.